Hi, my name is Abigail Negron, and I will be talking about the effects of music therapy on anxiety of patients with breast cancer following a radical mastectomy, a randomized clinical trial. So the problem presented in this study is that anxiety is a huge psychological symptom when it comes to this population of patients. Researchers have found that breast cancer in the female population in China has been high, and they have found that individuals suffering from breast cancer have had an increase in their anxiety levels, which is starting to become a common problem. So not only is the diagnosis a stressful situation and can increase anxiety levels, also the treatments such as surgery, chemotherapy, radiotherapy can also have an impact on anxiety levels and can be very stressful for the patient. So researchers wanted to test the hypothesis that music therapy can have an impact on these anxiety levels and can decrease them. Another hypothesis that they were testing is that treatment effect changes with follow-up time. The goal of the study is to show the effect that music therapy has on anxiety of female breast cancer patients following a radical mastectomy. There have been studies done previously that have shown that music therapy has had an impact on anxiety levels and has decreased them in cancer care patients. So this study is to just further that evidence and to show and to solidify that music therapy can be beneficial. So its significance to nursing, it can offer an alternative treatment when it comes to reducing anxiety. So instead of offering anxiety medications, nurses can offer this alternative treatment for anxiety, music therapy. So anxiety is not only a psychological problem, it can also cause physical problems such as difficulty sleeping, increased heart rate, digestive problems, sleeping problems, and so on. So this music therapy can focus on both the physical needs and the psychological needs of the patient. So the theoretical framework that was used in this study was Lydia E. Hall's core, care, and cure model. So the core part focuses on the patient themselves. The care portion focuses on the bodily care of the patient, and then the cure portion focuses on the aspect of nursing behaviors, so things such as administration of medications and or treatments. So the variables identified in this study, the independent variable was the music therapy, which is the intervention, and then the dependent variable is the state anxiety score or levels that were based off of the state anxiety inventory. The interventions used, so we had our patients separated into two groups. We had our experimental group and then we had our control group. The experimental group was offered the music therapy, and they were given an introduction of what types of music they were being offered and the music name. So patients were able to select their own types of music and listen to them. The music therapy sessions were 30-minute sessions offered twice a day, so once in the morning and then once in the evening. So the control group was not offered any music therapy. They were only provided with the routine nursing care that was given for them. But they also took part in the pre-test and the 3 post-tests, as well as the experimental group. So the sample consisted of 120 female breast cancer patients. They were divided into 2 groups. The experimental group was with 60 patients, and then the control group had 60 patients as well. And this was a random procedure that was done off of a computer program. So the individuals picked were random. So in order to be a part of the study, you obviously had to be female, ages between 25 and 65, and diagnosed with breast cancer that required a radical mastectomy. So in order to not meet the qualifications of the study, individuals were allergic to sound, they did not like listening to music, and they had voice sensitivity of epilepsy. So individuals who had 1 or all 3 were not qualified to participate in the study. So the ethical components, researchers explained to participants what the study consisted of and were provided with a written consent form that showed that they were voluntarily participating in the study, and this was approved by Human Research Ethics Committee. So the data collection, two methods were used. We had our standardized demographical data questionnaire, which was used and included a number of factors such as age, occupation, monthly income, marital status, and the age that they were first diagnosed with breast cancer. And then we had our state anxiety inventory, which scored the levels of anxiety. So the score ranges were from 20 to 80. We had 20 being the lowest, and then 80 being the most severe, experiencing anxiety. So the results of the pre-test scores, there wasn't a significant difference when it came to the experimental and the control group. But when looking at the post-test scores, the state anxiety scores in the experimental group were lower than in the control group. And this was something that the researchers were hoping to look for. So it supported the hypothesis that music therapy can reduce the state anxiety scores in the experimental group than in the control group. So there were some limitations when it came to the study. The data was self-reported, so there could have been it could have been influenced by a number of factors such as misinterpretation or other attitudes of the patients. There was only quantitative data that was collected. There were no physiological variables used in the study, and the control group only received the routine nursing care. So its application to nursing, it can increase patients' life satisfaction and well-being. It can increase their morale when they're receiving treatment, or if they're going through they're receiving treatment and they're going through this rough time in their life. And it also is a way to provide a non-pharmacological alternative. Instead of just giving them anxiety medications, we can provide for them this alternative music therapy, and that can help in reducing their anxiety. So in conclusion, by using the core care and cure model, researchers have found that music therapy can be beneficial when it comes to reducing anxiety in female breast cancer patients. It can benefit a number of patients in China. This was the study was done in China, if it's generalized in the clinical practice. So music therapy has potential to be a anxiety reducing factor, and it's something that we should incorporate all throughout hospitals, facilities, wherever, instead of just offering the pharmacological solution. Thank you very much.